So I was reading about fractures and I came across these types of fractures, and this classification of fractures is actually based on what is causing the fracture. So I came across what is known as a metastatic fracture. I came across what is known as an infective fracture. I came across what is known as a benign traumatic fracture. So all of them is just based on what actually caused the fracture. You understand? So let's define all of them. It's just definitions. And these are the types of fractures based on what is causing it. So metastatic just simply means what? There was a cancer somewhere. The cancer moved to the bone. Okay, cancer cells are eating up the normal bone cells and the whole structure is disrupted. You understand? So the bone is structurally compromised by what? The tumor infiltration. You understand? So the bone is becoming weak. So even a small force that normally your bone should withstand is taking you into fracture. So pathological fractures in older adults that have an underlying disease condition. So most of those patients, if you take a medical history, you get to see that they have had a particular cancer, right? So you manage it by trying to treat the underlying issue they have had before. Then we have infective fracture. This is because there have been an infection either in the bone primarily, or the infection spread from elsewhere secondarily to the bone. So the infection has been destroying tissues, reducing structural integrity, leading to fractures. So common causes are those chronic osteomyelitis, tuberculosis of the bone. So clinical clues is, if you take medical history, you see that okay, this patient has had an infection before. You see osteomyelitis either primarily from the bone or infection from another place, it tracks to the bone. So treatment is mainly you are trying to tackle the underlying infection. Then benign traumatic fracture now is just a normal fracture occurring in otherwise healthy bone due to sufficient trauma. Okay, so there's direct injury of force exceeding the bone strength. Okay, so there's a clear trauma history. When you take a history, you see that okay, this person has had this force involved accident. Okay, so this is what we got for the different types of fractures based on the underlying cause.